Okay, so you're here because, like us, you want to cut through the noise and really understand what's going on.
Yeah, get straight to what matters.
Exactly. And today, we're looking at something that's, well, making a bit of a surprising comeback. Measles.
It really is. Quite concerning, actually. Measles was something many people thought was, pretty much dealt with.
Definitely felt like it was in the rearview mirror for a lot of us.
But we're seeing a clear rise in cases globally now.
And that's exactly what this deep dive is about. Our mission, really, is to unpack why it's coming back and, crucially, what we can possibly do to stop it.
It's a vital question because measles, well, it's often seen as just a mild childhood thing, but it can have serious complications.
Right, especially for vulnerable people. So understanding this comeback,
hmm
it's pretty important.
Absolutely vital.
Okay, let's get right to the heart of it then. The headlines are everywhere. Measles is back. This isn't just a small blip, is it?
No, the data shows a definite upward trend. It's happening across several regions, not just one isolated place. It's a broader public health issue.
So the big question, why? Why are we seeing this now? What's the main thing driving it?
Well, a primary factor seems to be falling vaccination rates. Simple as that in many ways.
Huh.
Measles is vaccine preventable, so when fewer people are immunized, when coverage drops below a certain point,
The virus just finds it easier to spread?
precisely, that critical level herd immunity starts to weaken.
So it's directly linked to fewer people actually getting the shot.
That's a huge piece of the puzzle, yes. Herd immunity protects everyone, even those who can't get vaccinated for medical reasons. Weaken that.
And outbreaks become much more likely. It really shows how connected we all are, doesn't it?
It absolutely does. Individual choices have a collective impact, and it's not just about the first shots either.
You mean maintaining those high rates?
Exactly. Sustaining them over time is key to keeping the virus out.
Okay, but if the vaccine works so well, why are rates dropping in some places? That seems counterintuitive.
It's a really complex issue. There isn't just one single answer, unfortunately.
Hmm.
A big part, undeniably, is misinformation and the vaccine hesitancy that comes from it. People get scared, confused.
Yeah, you see a lot of that online.
You do.
Yeah.
But it's also about access. Can people easily get the vaccine? Are public health systems strong enough?
And disruptions too, I suppose, like during pandemics or other crises.
Absolutely. Disruptions to routine immunization programs, they leave gaps. They leave populations vulnerable.
It really does feel like we're losing ground on something we'd made so much progress on.
In many ways, yes. I mean, the U.S. declared measles eliminated back in 2000.
Wow, 2000.
But elimination doesn't mean eradication globally. So cases get imported from places where measles is still common.
And if they land in a community here that's under-vaccinated,
You get an outbreak. That's what we're seeing.
looking at the bigger picture, what happens if this trend just keeps going? What are the potential consequences down the line?
They're serious. More cases mean more kids, especially facing severe risks. Pneumonia, encephalitis, brain swelling,
It's scary stuff.
and even death, tragically. Plus, outbreaks put a massive strain on doctors, hospitals, the whole healthcare system.
That is a grim picture.
Mhm.
So bringing it back to our mission,
Mhm.
stopping it, what are the real possibilities there?
Well, the cornerstone is, and always has been, strong vaccination programs, getting that MMR vaccine uptake high, both doses,
Right.
but also, critically, tackling why people might be hesitant. Clear communication, using evidence, building trust.
So it sounds like it's not just about the needle, it's about the narrative too.
Yeah.
Addressing the reasons for the decline is just as important as the vaccine itself.
You've hit it exactly. Strengthen public health, make vaccines easy to get, and actively combat misinformation while building trust. That's the multi-pronged approach needed.
Okay, so measles is making a comeback, no doubt about it. And
Yeah.
stopping it seems to hang on everyone committing to vaccination and tackling these sort of underlying issues.
That really is the fundamental point, yes.
So for you listening, here's something to think about. We've talked about the vaccine's power, the disease's real dangers, and why it's resurging. Given all that, what do you think are the most crucial actions we need to take to really change the future of measles outbreaks? Definitely something to chew on.